New studies suggest that young Americans are talking about depression and anxiety too much, and it's not helping anyone. The New York Times reports that studies done in the UK and Australia found students who underwent training in the basics of mindfulness, cognitive behavioral therapy, and dialectical behavior therapy, and they did not emerge healthier than peers, and some were actually worse off. The Times said this research comes as, quote, mental health has become a central subject in childhood and adolescence. Teenagers narrate their psychiatric diagnoses and treatment on TikTok and Instagram. School systems, alarmed by the rising levels of distress and self-harm, are introducing preventative coursework in emotional self-regulation and mindfulness. Two research psychologists at the University of Oxford said, quote, awareness campaigns were contributing to young Americans self-labeling themselves as having depression or anxiety, though many mental health specialists disagree and argue lack of access to treatment is the bigger problem. I don't know, I do see a lot of self-diagnosis on TikTok, but I do think mindfulness should be the first step, right? Trying these alternative methods, because in the US we throw drugs at a lot of issues, and I think that's a big problem, especially in a developing brain. I think there's a place for medicated treatment of mental health, but I do think we went through this period of, okay, we're gonna take this seriously as a healthcare issue. And it resulted in the classic American way of we're gonna throw some pharmaceuticals at it. And I think it's good that we're swinging in the other direction of trying other things before going for the pills first. But I will also say, I remember talking to my psychiatrist because I have ADHD. And she said, you know, it sounds like you have anxiety. And I was like, you know, what indicates that? It's like, you know, you said you're worried about like the state of the world, you stay up at late worrying. And it's like, have you been outside? Like, is this a me thing or is this the world we live in thing? And so I do think that that's a big contributing factor.
Yeah, I actually have a very similar experience. So after my dad passed away, I decided to go see a therapist because everyone around me was like, oh my gosh, you have to talk to somebody. Like, you're going to fall apart if you don't talk to somebody. So I went to see this therapist, and in the first session, literally within the first 2 minutes, he said, are you depressed? Do you think I need to prescribe you an antidepressant? And I was like, first of all, I don't think I'm qualified to make the determination as to whether or not I need an antidepressant. But two, like, I'm pretty sure I'm just sad because my dad died. Like, I don't think like clinical depression is the right way to describe what I'm going through. And that sort of reflexive nature of going to the prescription of drugs to treat what I think are like normal and healthy emotions in a lot of cases is really disturbing. And this larger point that the New York Times is hitting at is something I've heard before, and it's the idea that if you talk too much about your feelings in a way that sort of medicalizes them, that it often makes you feel like these things are completely out of your control, which can spiral you into a deeper and worse emotional state because you're basically giving up like control of your emotions or control of your emotional state. For young people, that can be a really attractive way to view things that you're going through in your life because you don't really want to take either responsibility or you want to think that the world is happening to you as opposed to you happening to the world. And it, unfortunately, we have more people going to therapy than ever, but we have higher rates of anxiety, depression, and other mental health disorders than ever. So clearly something is not adding up.
Yeah, I love that emotional thing. I heard recently if you can't control, your thoughts, they're kind of a parasite in your head. I'm not talking like RFK Jr. brainworms here, but it is interesting to think about that we have to really ground ourselves because we're impacted by so much information all of the time. We're processing so many things. We have so much to do all day long. It's hard to get to a place where you feel like you're not constantly working through problems and thinking about everything that's going on in your life. And a lot of these mindfulness practices have been helpful even to me who's on ADHD medication, where instead you just like recognize your thoughts, you let them pass by, and yes, reflect on your emotions, but there are more positive ways for dealing with them. That yes, there's a lot of things wrong with the world, but there are a lot of people who are very hopeful about fixing the problems. There are a lot of people who want to do that work. And if you talk to people, you realize most people are good. And I think when we get away from our, communities, whether it's our family or locally, that's when we get to this place of feeling alone. We have a very individualist society, and I think people are starting to realize that that's a source of a lot of stress, and that they need, more support and validation and other people around them to just be in community and talk about the issues and realize, okay, people are reasonable and they want good things, even though we see a bunch of trolls online saying ridiculous things more often than we hear the positive stuff.
There is something to be said for being willing to sit in discomfort and taking the time to actually feel those emotions and letting them pass. It almost seems like something that's stigmatized in a way now, where you want to find the quick fix to get rid of whatever bad emotion that you're feeling. And then obviously those things just pile up and often get worse. Jonathan Haidt, the social psychologist, has a new book out about the specific impact that social media has on young people and mental health. And he cites a lot of correlative studies between the rise of social media and self-reported impacts on young people's mental health. And it speaks directly to this issue about community, because young people talk about, we find our communities online and with people who aren't in our direct vicinity, but there's still a screen between you. And when you bury your nose in your phone all day and are only talking to other people on the internet, what kind of impact does that have on your psyche? Does it actually further negate your ability to actually connect with the people who are around you, the people in your family? And the research suggests that it does, that it's not a healthy way for young people to go about their daily lives.
Living in a country where healthcare is not guaranteed, many people struggle to access it, but also mental health care isn't considered healthcare, it is a problem that a lot of people who are really struggling with mental health issues and substance abuse especially, I think it's a self-medication that happens a lot of the time when it is substance abuse. And my father was an alcoholic and got sober and read Thich Nhat Hanh, who's a Buddhist monk, Pieces Every Step, and a lot of his other readings. And that was, key for him. He also found community and went to support groups. But I think the mental health crisis comes in tandem with the substance abuse crisis. And I think the decoupling of mental health care, just health care, and saying, it's all health care, would be useful. The decoupling, I think, has been a bit of a problem for our ability to treat. But also the lack of access leads to people getting curious. If they're not self-medicating, they're trying to find information, and they're finding it, on TikTok, where is it good information? And I think we need to get to more of a place where we see these two things as the same. Mental health care is health care, and it should be more accessible to young people. It's prohibitively high in cost. We're paying more in this country than all of the other modern economies that provide health care. And even the countries where they say, there's long wait lines, I have good health care in the United States. If I call for an appointment, I've got to wait months. So I would honestly rather have healthcare be covered and I wait in a line for an hour or two and I can be seen that day. And I think we've really got to be critical of how much this has been influenced by corporations, the pharmaceutical companies and large health insurance companies that have been lobbying our members of Congress to not provide this as a public good, which is possible, or at least address the information asymmetry that's out there between consumers seeking healthcare and between the healthcare companies, or at least making it so that private companies are not profiting so exorbitantly off of people who just want to live a healthy life.
Yeah, big corporations and pharmaceutical companies also don't want people to know that a lot of times you can, if not cure, at least significantly help things like anxiety and depression by changing your diet or getting daily exercise or getting a good amount of sunlight every day. Those obviously aren't things that cost money. I mean, healthy food costs money, but you're not paying through the healthcare system, so they don't want you to know that those are options for you if you are struggling with some of these, maybe not severe clinical depression, but dealing with a minor case of depression or anxiety. I think we should also be pushing back on self-diagnoses, because when we do see some of these trending TikTok things where people are talking about these new mental health problems they've come up with, or they are pretending to be have tics, like they have Tourette's syndrome. That seems to be a common thing on the apps, and I do think it takes away the focus on people who really are struggling and makes it harder for them to be taken seriously. You brought up the connection between mental health and substance abuse, which I think is really important. And when we are talking about particularly working class men And specifically in our country, working class white men, there's also an economic component to this too, because we've seen the hollowing out of the middle and working class over the past 2 decades due to the offshoring of manufacturing, and that's left a lot of rural communities really broken. And we see people turning to opioids and other substance abuse issues because of that economic reality that's happening to them. So all of these things are really interconnected.
Yeah, I think it's true that rich people can be sad, but I do think the mental health crisis is a part of the economic crisis we have in the country. Because in a lot of these towns, you have one major company. Like I think about Detroit during World War II and what happened after manufacturing didn't happen in Detroit after World War II, and what happened to the city and what happened to the people living in the city. There's cities like that all across America where big companies come in and they're the center of the economy, and when they pull out, there's not much left behind, because there is still this culture that we have in the US, regardless of how many strides we've made towards, the equality of women in work. There is a pressure that a lot of men feel today in America to be the provider. And the stress of being the provider and not being able to provide results in this: the problem is me. I don't have enough skills, I don't have enough talent, when really it's a macroeconomic issue that they don't have the economic opportunity that they would need to provide for their families. It's something that can be addressed with policy as well. And so when we think about our elected officials not doing enough to ensure that our economy is sustainable for working people, that's who we should be angry at. We shouldn't be angry at the men in our family. We shouldn't be angry at ourselves if we are one of those working men. We really need to collectively say, okay, this is our democracy, and there are deliberate policies that can be passed to prevent the offshoring of American labor and prevent the over-reliance on just one company in these small towns.
Yeah, I guess we could summarize by saying that the New York Times has a point when they say that maybe we're talking about mental health too much, but I think really it's that we're talking about it in all of the wrong ways. We'll be back with more Rising after this.